Hey, good morning. I'm Patricia Murphy. It's Wednesday. This is Seattle Now. The Centers of Disease Control and Prevention are rolling back a decades-old standard for childhood vaccination. An advisory committee is recommending vaccines for Hep B no longer be given to every child. KUOW Infectious Disease Specialist Dr. Helen Chu is here to tell us why and what could change in a minute. But first, let's get you caught up. Three cities surrounding SeaTac Airport are taking legal action to try to block the airport's long-term expansion plans. The cities of SeaTac, Burien, and Des Moines are asking a court to review the FAA's November approval of 31 projects planned at the airport. They include a new terminal, which Port of Seattle officials say is necessary to handle an expected increase of 4 million more passengers a year. Seattle Times reports city officials say the increased traffic and overhead noise from up to 600 jets a day is harmful to people who live nearby. Black, Latino, and Native American people charged with violent crimes in Washington are more likely to have their cases transferred to adult court compared to their white peers. The reporting from Investigate West found that 83% of the juvenile cases charged in adult court are those of Black, Latino, or Native American youth. That's despite a 2018 state law aimed at reducing the numbers of minors charged as adults. A King County prosecutor told Investigate West state law requires 16 and 17-year-olds charged with murder to be tried in adult court, which limits their discretion. And Washington Congressman Rick Larsen has introduced a bill that would provide veterans with free public transportation to VA facilities and service organizations. Larsen says vets living in rural areas and on the islands especially have trouble getting to VA hospitals and clinics. Larsen's bill would establish a pilot program within the Federal Department of Transportation. Check back for more headlines on tonight's episode of Seattle Now. A CDC panel voted last week to recommend the hepatitis B vaccine only to the babies of mothers who test positive for the virus. For everyone else, doctors and parents will have a conversation about the risks and benefits of the shot, a process called shared clinical decision-making. The Washington Department of Health and the West Coast Alliance are pushing back. Our state will continue to recommend hepatitis B vaccines for newborns. It's not the first vaccine rollback from the CDC under President Trump, who also ordered federal health officials to look at the U.S.'s childhood vaccine schedule, which he calls a high outlier. KUOW Infectious Disease Specialist Dr. Helen Chu is here to talk about it. Dr. Chu, always good to talk to you. Thanks so much.
Yeah, thanks for having me.
Honestly, you just don't hear a lot about Hep B, Dr. Chu. What should people know about it?
So hepatitis B is transmitted through bodily fluid. So if you have a small scrape or if you have a cut or just something where you accidentally touch somebody who also has a break in their skin, you can acquire hepatitis B. It's very, very infectious. And so the concern is that, especially with these babies who are potentially exposed to individuals who might be chronic hepatitis B carriers, they could be at risk to acquire hepatitis B early in life.
What is the CDC recommending now for hepatitis B vaccines?
So the committee meeting happened over the last 2 days, on Thursday and Friday, and the vote was around whether or not we would continue a universal hepatitis B vaccine at birth. And what that means is that every child who is born is given the hepatitis B vaccine to protect them from acquiring hepatitis B either from their mother at the time of birth or early in life. And the change that was voted on was to remove this universal recommendation and move it to two pathways. One pathway for mothers, as you say, who have a positive test for hepatitis B during pregnancy. And for those, we would still recommend that vaccine at birth to protect their babies from acquiring hepatitis B. But for the vast majority of individuals, what we would be moving to is a shared clinical decision-making recommendation, which means that the provider would have a conversation about the risks and benefits of the vaccine before giving that vaccine to the baby at birth.
And this vaccine has been effective, right?
So the hepatitis B vaccine, when given as studied, which is 3 doses, is over 90% effective at preventing acquisition of hepatitis B.
Then why drop a decades-old mandate? Let's talk for a minute about the reasoning behind this change.
The reasoning for the change in this recommendation was because the committee felt that individuals who are at risk for acquiring hepatitis B should be treated differently from individuals who are not at risk for acquiring hepatitis B. But in practice, there's really no way to decide who is at risk. And prior to 1991, we did have a risk-based recommendation where people who were thought to be high risk were offered the vaccine at birth, where those who were not considered high risk were not offered that vaccine at birth. And what happened was that it just led to hepatitis B infection in babies. And when a baby gets hepatitis B infection early in life, they're at much higher risk to go on to chronic infection and to develop liver cancer later in life.
How might this show up for clinicians? Because I know you have experience with treating Hep B. Let's talk about that for a minute.
The problem with this recommendation and this particular change is that hepatitis B is often silent for many, many decades. And the way it will show up is that teenagers or young adults will have chronic liver disease, so liver cirrhosis or liver cancer. So back when I was in training, I took care of a patient who was 19 years old who had liver cancer from hepatitis B that she had acquired at birth from her mother. And she was born in that time period right before universal birth dose recommendation. So she did not receive that vaccine at birth. And so she was hospitalized and subsequently died from her liver cancer. It really speaks to this idea of risk stratification and us being able to figure out who's going to get an infection and who's not going to get an infection, especially at the time of birth, which is, as the committee pointed out, a fraught time. When you're giving birth, it's chaotic. It's hard to make decisions. So really having this universal birth dose recommendation allows for every single baby to be protected.
You know, how are you thinking about this? Because you spend your time tracking and trying to prevent the spread of viruses. Hepatitis B and its consequences are vaccine preventable. I can't imagine how somebody like you thinks about it.
It's really hard to think about moving to a policy that didn't work, that we know didn't work back in the 1980s, and resulted in a change that did work. And now we have almost complete elimination of hepatitis B infections in young children. To do that, you really need demonstration of risk. And the committee did not show any data that showed that this vaccine was associated with increased risk or that there were new pieces of information that would allow us to make a different decision than the one that's been in place for several decades.
Well, what does this mean for insurance coverage then?
The shared clinical decision-making recommendation is covered by health insurance in the same way that a full recommendation is covered. So children who have insurance, either public or private insurance, should be able to receive this vaccine at no cost. The difference is the documentation that's required by the provider before giving the vaccine, as well as the public perception of risk. You don't really have this type of recommendation where you extensively discuss the risks and the benefits of a vaccine unless there are true risks to discuss, against which you have to outweigh the benefits. Here, the benefits are very clear, and there is almost no risk. And so moving it to this type of recommendation really gives parents pause when they're trying to decide what to do with their newborns.
Let's talk briefly about shared decision making. What does that conversation sound like? What is the panel now recommending?
The panel seems to have confused informed consent with vaccine mandates. So for all vaccines, we discuss the risks and benefits of the vaccine before we give it to a patient. They're asking now to move away from regular informed consent to shared clinical decision-making, which is a much longer discussion, which implies that the benefits and the risks are equal. And we need to have a discussion about whether or not the benefit to the individual outweighs the risk to the individual before we administer the vaccine. For hepatitis B, that's not the case. There is really no risk to this vaccine. So a shared clinical decision-making recommendation where you have a long discussion about risks and benefits and make individual decisions is not appropriate.
How should parents think about this?
I think parents should go with the prior recommendation. We know that worked. We know that many doses, millions of doses have been given over the decades. And there has been no new information that makes us think that this vaccine is not safe or does not work. This vaccine is safe, it works, and it prevents the development of chronic liver disease in these very, very vulnerable infants.
Could these changes in messaging from the CDC lead to confusion and vaccine hesitancy from people?
I think that we are already seeing the impact of these meetings on public perception of risk and concerns about vaccines. The fact that on day 2, we had an anti-vaccine trial lawyer who spoke for almost 2 hours, going over things that were clearly untrue. What it does is it legitimizes things that were once very fringe, and it gives this anti-vax community really a public platform to speak to parents and providers in a way that increases distrust of the entire system.
President Trump asked federal officials to look into our childhood vaccine schedule. He says countries like Denmark and Japan vaccinate children for fewer diseases than the U.S. Why doesn't Denmark vaccinate for Hep B?
So Denmark is a completely different place from the United States. Denmark is much smaller. It's the size of Wisconsin. It has a universal healthcare system. It has very, very good prenatal screening. So every mom who's pregnant gets a blood draw to test for hepatitis B exposure. If we had universal healthcare in a system where 100% of people could have this testing done, then we would be in a different place. But that's not what we have. About a fifth of pregnant women do not get hepatitis B testing during pregnancy. And there are just so many other things in the United States with the fragmentation of our healthcare system that make it very difficult for us to look at Japan and Denmark as comparators.
Okay. It does make me wonder if the West Coast continues to push back against the CDC guidance, what the long-term effects could be for a country with varying vaccine mandates.
Yes, it certainly gives me a lot of concern to think that certain states are going to continue to follow policy guidelines from the American Academy of Pediatrics and other organizations that are still following the science, whereas other states are going to go with the ACIP and the CDC recommendations and what that means for our healthcare system as a whole.
And we're in the peak of infectious disease season right now this winter. Are you seeing spikes in COVID and the flu? Could this show up this quickly? We talked a little bit about vaccine hesitancy.
So overall vaccine uptake seems to be down for both COVID and flu in the United States. Right now, we are not seeing too much COVID circulating. I think it's because we had that late summer, early fall wave. For flu, we're starting to see the numbers go up. What's a little bit concerning about flu is that the data that's coming from Europe is showing the emergence of a new flu variant that is not well covered by this vaccine. And the early data from the United States is starting to show that this is the predominant variant that's circulating. All vaccines do protect against severe disease. So I think the message is that there's still time, especially as we head into the travel season, for people to still get their flu vaccine, because it is looking like it's going to be a bad flu season based on the data that's coming out of Europe.
Yeah, important information. All right, before I let you go, we started this conversation talking about a change in the childhood vaccination recommendations. What else could be coming out of this committee in the next year?
They are planning on reevaluating all of the childhood vaccines, and they are also planning on discussing the use of components of the vaccines like aluminum and going over the data. They're also interested, I believe, in reevaluating the RSV products that were just licensed and put in use and have been very, very successful in preventing children from getting sick with RSV. That is what is coming.
UW Infectious Disease Specialist Dr. Helen Chu, really appreciate you taking the time. Thanks so much.
Thank you.
Appreciate you listening to Seattle Now, and thanks to our generous donors for your support. Help us out by clicking the link in the show notes and following and rating the show on your podcast app. Today's episode was produced by Vaughn Jones. It was edited by Caroline Chamberlain Gomez. Our production team also includes Andy Hurst, Brooklyn Jamerson Flowers, and Paige Browning. Greg Kramer does our theme music. Seattle Now and KUOW Public Radio are members of the NPR network. I'm Patricia Murphy. See you soon.